We're here in the office today about 2 months after an operation, which included a decompression of the common perineal nerve at the fibular head, a decompression of the deep perineal nerve on the top of the foot here, as well as the proximal tibial nerve in the calf, and the tibial nerve in the tarsal tunnel. And the goal of this operation was to help this patient with pain and numbness and burning and tingling in her feet that she's had for many years. And so can you describe those symptoms that you were having, how long you had them, and how you describe the symptoms you had in your feet?
Sure, progressively worse over almost 10 years, to the point that I thought that this would be how I had to live. Tingling, burning sensation, numbness, pins and needles, the toes, the ball of the foot felt like walking on a ball, a rock. A lot of pain. Sleeping was difficult.
Now, why was sleeping hard?
Sleeping was hard because the stinging and the tingling would just wake me up at points in time.
Okay.
And very uncomfortable, and didn't matter what position I was sleeping in. Walking became limited. I didn't like to stand for long. And I loved to walk, but I could not walk for long.
Okay. And when you had come to our office, you had a diagnosis of peripheral neuropathy, which had been treated medically, which is, of course, appropriate when there is no sign of nerve compression. You had multiple medications. Some of them had side effects. They didn't work. And when we examined you, fortunately, you had what we call a Tunnel sign, which is when we tapped on the nerve, you had basically a funny bone feeling with that electricity run down into your foot in the appropriate distribution. And so we had suspected that perhaps you had some nerve compression as a cause of the neuropathy, multiple locations pinched, the common perineal nerve going to the top of your foot, the tibial nerves, both proximal and distal, going to the sole of your foot. And so we discussed releasing those nerves. We moved forward with the operation, and it's now 2 months after surgery. What have you noticed in those 2 months?
In the 2 months, it's just been a healing of the pain from the surgical incisions.
Okay.
So mainly that, the tingling, the burning, the pins and needles, completely gone, which is amazing to me. And I did not know how special this was. And so, Dr. Williams, I had to give it to you because you stayed with me the first time for 70 minutes, 7-0. You did an examination on my leg, which led me to understand how that was really affecting in the feet. Almost came off the table when you did that exam.
I remember. That's why we did this operation.
Yes.
So it's interesting. This operation here, how do we know the nerve is compressed? We never 100% know, but we believe it's compressed when the patient has the appropriate exam. And she had the what we call the open eyeball sign. Literally her eyes popped open and jumped off the table.
Yes.
So, and that was a clue that might be the problem. How's your sleep now?
Sleep perfectly. Sweet sleep, no pain to wake me up, and no sensations in the middle of the night either.
That's fantastic. And your pain used to be 24/7, is that correct?
24/7
All right.
was my pain.
Would you consider this a fairly successful procedure for you?
I am so thankful for meeting you, being referred to you by my friend, who's an orthopedic surgeon in Chicago, taught by Dr. Dillon as well, and just the patience and the care that you gave to me. You spent good time. You explained to me what was happening, why it was happening. You gave me my options. I'm so glad that you told me about the gastroc muscle as well, because I don't have that sensation on the ball of my feet, walking on rocks. That's gone too. So now it's just more of the healing, getting the flexibility back the way it should be. And thank you for the referral to physical therapy, because that is working as well too.
You're very welcome. Well, this is good news, so thank you very much.